Hi everyone, and myself Dr. Bharath Kumar VD, your Pharmacology faculty PrepLadder. So in this video, we'll be discussing how to study pharmacology in next exam or for the next exam. Should we change the pattern of study or should we continue the same? So let us understand that. Now recently we received a draft from NMC stating that they are going to conduct next pattern of exam in the future. So let us analyze what is that pattern of exam. The pattern of exam consists of two steps. The next, that is step 1, it's a theory exam and you have MCQs and it's a computer based test. And totally there will be 6 papers and mainly they are medicine and allied subject and 120 items and the duration is 3 hours. Surgery and allied subject 120 items 3 hours. Obstetrics same thing here. And pediatrics, ENT and ophthalmology have 60 and time duration is 1.5 hours for that. So that is the duration given by the NMC in the draft guidelines. Now what is next step 2? It's nothing but it's a practical and viva what is already being done in the medical colleges. So here there will be 7 papers: medicine and allied disciplines, surgery, OBG, pediatrics, ENT, ophthalmology and orthopedics, and physical medicine and rehabilitation. So here it is basically a clinical cases or a simulated cases, and that will be done in the universities. But the next step 1 is a common exam across India. Now once we know that, what will be the distribution of question in next? Now if you read this, 65% of the questions are clinically based. So they are clinically based questions. 25% are comprehension type. That means you have to read the question, analyze it, and then come to the conclusion. That is called comprehensive type. 10% are recall based. So they are memory based. And if you see that, most of them are application type. So what we are going to do in the future is application of what we learn. How the subject will be integrated in next. So they have also given another guideline that in each paper, 10% of items will contain anatomy, physiology, biochemistry, microbiology, pathology, pharmacology, forensic medicine relevant to the subjects evaluated. In each 10% items will pertain to be applied aspects of public health and community medicine. So there is also inclusion of PSM. Now, if you see the pattern of exam, we feel that the exam looks like clinical. You may ask a question, sir, should we study pre and para subject? Let me clarify this. So how do I clarify this to you? So let me clarify this to you and let us take the consideration. For example, you are reading physiology. So physio, then patho, then pharma. So you should be knowing what is normal, what is abnormal, and then the treatment. Suppose if you don't know what is the normal temperature, then how will you know fever? If you don't know fever, then how will you treat the patient? That's why it's important that you know the normal thing, the abnormal thing, and you know the treatment. So remember, these are the 3 pillars which make the medicine. These are the 3 pillars which make the medicine. And medicine and allied subject like medicine, psychiatry, pediatrics, they all consider these 3 P's. Now, whenever you are diagnosing a disease, you require the biochemistry investigation. So that is also important. Let us take the example of anatomy. When you know anatomy, that is how the human body is made up of, then you should understand pathology. And when you know what is pathology, you will understand surgery. First of all, you should know what is a normal tissue. Then you will understand what is abnormal tissue. Then only you will decide whether you do the surgery or not. So when I talk of surgery, the allied subject, what we are talking is the ENT, ophthalmology, orthopedics, and the main surgery part. Now, another important part of knowing anatomy is to understand radiology in a better manner. So if you see this, everything is integrated. So that is why this is what the future of medicine is, integration. Integration is the future of medicine. Now, when you learn all these things, The purpose of the NMC is to make you a competent doctor. So we want a competent doctor who knows the things and applies that. Not only applying himself and to the patients, he will apply to the society, and that is what we mean by preventive and social medicine. Not only knowing the preventive and social medicine, he should be aware of certain legal complications and legal implication and its roles and responsibilities, and that is taught in forensic medicine. So that's the reason everything is integrated. So any question if they frame, it will involve the physiology, pathology, pharmacology, pre and paraclinical subject, and they may be asked separately also, but it will be there. So that's the reason you cannot ignore pre and paraclinical subject. That's why they have given the 10% of weightage for this. Now moving on to what is the eligibility criteria, who can take up this? Any MBBS graduate and any foreign medical graduate where the education is approved under NMC, and anybody who has a medical degree for the purpose which is approved by National Medical Commission. So they are eligible for the next pattern of exam. Now moving on to what is the time schedule of the exam. So it's an exam, and we have the exam in a day. For example, if you take medicine and allied subject, the duration of 3 hours and there is a gap of 2 hours. After that, you will have the pediatrics with a duration of 1.5 hours. Then a day of rest with no exam. Then the surgery and allied subject, 3 hour, 2 hour gap, and ENT. OBG, 3 hours and 2 hour gap, and then followed by ophthalmology. So this is the tentatively given schedule of exams. How many attempts can be given? No limits within 10 years of admission. So step 1 score is taken, and remember every attempt is most important because they are going to take the average of the 3. So that's why you have to take the attempts carefully. Very much important. What are the advantages of NExT over NEET PG? The advantage of NExT is you will have the exam to decide whether you are going to get a PG seat or not. Second is it will be a licensed exam like USMLE. And what happens actually before when we had NEET PG exams is that you had to complete the internship, then start studying. So you had 5.5 years and then waste another 2 years for NEET PG preparation. Now the advantage what we have is you can study, and you will study in early days. You won't be wasting your time. As soon as you finish your internship, you are into the post-graduation and you start your practice. So that time gap will be shortened up. And another important aspect of NExT exam is most of the times what we do is try to study unnecessary things. And now when the next pattern has come, we will understand the things which make us competent doctors. What is most important? Suppose you study pharmacology, you know a drug. If you don't apply that, then what is the use? You will forget that. If you remember in your plus 1, plus 2, that is 11th and 12th, you have studied integration and differentiation. Now tell me, when did you apply that? Never. So that's the reason why the next pattern is going to help us. So the next slide, what I am going to tell you is how to study pharmacology for next pattern. So I told you there are 3 P's which we follow: physiology, pathology, and pharmacology. So you need to know physiology, what is normal, then only I can teach you pharmacology. You should be knowing what is the disease process, then only you will understand the treatment aspect. So that's why our lectures will have these 3 P's, a bit of physiology, that is called pathophysiology, and then you will see the treatment. And also in our videos, we have included case-based approach. Case-based approach. So it will be easier to understand. Suppose we are taking hypertension, we will tell what is the diagnosis of hypertension, ischemic heart disease, tuberculosis, what are the symptoms. So when we start case-based approach, you will understand the drug applications. So that is what we mean by applied pharmacology. Another important thing is integration. So when you study, try to integrate. Suppose you went to your clinics, you saw a patient of diabetes, you saw a patient of hypertension, you saw what tablet he is taking. Now try to memorize what is the simple mechanism of action of the drug. What is the common adverse effect? For example, patient is taking insulin. You should know what is the common adverse effect, that is hypoglycemia. If you don't know that basics, then how will you study pharmacology? That's the reason, try to integrate. So pharmacology has to be learned everywhere. That is because it is integrated with other subject also. So try to integrate. So clinical integration is most important. So the problem, what used to happen before, the problem is they used to study pharmacology in second year and then forget. Then they go to final year, then they see the patient. When they see the patient, they have already forgotten the drug. Then they don't know the drug. And when they finish their internship, when they come to the entrance exam, no drug is known to them except few. So that's why nowadays the advantage of NExT pattern is try to integrate clinically and you will never forget the drugs. So in our PrepLadder, we have made in such a way that you will understand in a conceptual manner, in an analytic manner, that is reasoning, and some recall based questions. So that is how we are going to approach the pharmacology in the NExT pattern of exam. Even if it is from US family based, we have covered that also. So don't worry for that. Now we are at the PrepLadder. We are ready with NExT pattern of exam. We have question bank is ready with that. Now if you take the example of certain glimpses of it. So we are given a question here. Cotrimoxazole is an antibiotic and we use it in an opportunistic infection AIDS patient. So which opportunistic infection are we using it? So the answer is pneumocystitis cirrhosis. Now by mistake you made a mistake here. The question bank will give you a solution. The advantage of the solution is every option is being explained in detail. Now you can see that why the option C is correct and you can see why other options are wrong. And once you solve the question, why did we frame the question? What is the learning objective? What you can take further, and you should never make the mistake again. So that is what we get here, and certain learning points also we get from this. Then moving on to the next question, you can see a patient has fatigue, metabolic alkalosis, hypokalemia, decreased plasminogen activity, and laboratory values and blood pressure are normal. What is the drug likely to be given to the patient? So here they have given propranolol, but the answer is spironolactone. So patient having hypokalemia and there is left suprarenal gland which is enlarged. So it points towards the Conn syndrome. So the drug used for Conn syndrome usually will be spironolactone. So you will see the case-based studies. You can see the case and which is given, and that is what I was telling you, case-based approach. So here also you can see why the option D is correct, then why other options are wrong, and also it has been explained what is Conn syndrome, what is it characterized by. That's what I was telling you, integration. When you study Conn syndrome in physiology, you wouldn't have understood. When you study in pharmacology, you will know the treatment, but when you go to medicine, you will understand in better manner. So that is already we are ready with this. Again, another question. Here the patient was given heparin. Now where do you give heparin? In deep vein thrombosis. How the patient presents with that? So those things are all explained. Previously the question was direct. Patient has DVT, given heparin. What is the mechanism of action? But now you will know what is DVT, what are the symptoms of DVT, and what is the drug we give, and what is the mechanism of action. So everything has been explained in this. Yeah. So the last question is, what about existing NEET PG and FMG PrepLadder users? So don't worry, NEET PG and FMG aspirants do not have to worry, as we will continue to provide latest NEET PG and FMG content on the app till the time it's relevant. So until the NEET PG or FMG exams are there, the content will be provided, so don't worry for that. So guys, we are prepared for NEET PG as well as for the future NExT exam. So join us in achieving your dreams. Thank you all.
Subscribe and press the bell icon so you never miss an update from PrepLadder.